All right, we're going to go ahead and get started. Just want to thank everybody, first of all, for attending tonight. We have some awesome people here to talk about some awesome programs that we offer here at Lakeland, and of course, other opportunities that we offer here at Lakeland, such as scholarships and good stuff like that. So tonight's agenda, we'll go ahead and get started. We're going to have someone from our admissions department and then financial aid and counseling present first. And then you'll actually get to meet all the program directors. They'll introduce themselves. They'll talk a little bit about their program. We'll have an open Q&A section. At that time, you'll be able to ask questions to anyone here on the panel. And then after that, we have some goodies over there. We got some food that we're giving away, and if you haven't done so already, there's a chance to win a raffle basket over there with a bunch of Lakeland swag items, t-shirts, sling bags, and gift cards. So make sure before you leave that you check that out and sign out for that. And then the labs will be open. So you'll actually have the opportunity to go and see the labs of whichever program you're interested in. Okay? So we're going to get started. And we'll start off with admissions first.
Okay, hello. I am Christina Hill. I am the Assistant Director for the Student Service Center. And I'm just going to pretty much walk you guys through the process from application to registration and how that process works. So the first step is to fill out the admissions application. So if you haven't been on our website or anything yet, you basically just click apply in the top corner, and then it takes you directly to our application. It's very important that you fill out the application accurately. It makes the enrollment process go smoothly. Just make sure, especially like your basic information is correct. We have had issues with that in the past. And for the admissions application, for this current spring semester, as well as the coming summer and fall, we are waiving our application fee. It was $15, so that fee is currently being waived. Once you have applied for once you've applied for admissions, you would be contacted within 1 to 2 business days via email. We would let you know the information, the My Lakeland portal that we use for students to access their information. You would get your login information for that, including a username, password, student email, and then it would it would give you the communication would give you the next steps in the admissions process. So official high school transcripts are required for admissions purposes. This requirement may be waived if you're transferring in 15 or more credit hours from a regionally accredited institution. So if you're unsure if the college or university that you've previously attended, if you have, you can contact our admissions office and we can give you more information to determine if you're going to need both the college and high school transcript or just the college. And then just to be aware, even if by admissions requirements you don't need the high school transcript, you may still need it for specific health programs. And you can contact your high school or Board of Education to have your transcript sent to Lakeland. For college transcripts, again, these are required for every college that you have previously attended, and you can contact the colleges for those transcripts to be sent to Lakeland. There's usually a process on their websites. I know that's how ours works, and there may be a small fee associated with requesting your official transcript. The placement test is used to accurately place students in English and math. If you have ACT or SAT scores, they can be used in lieu of the placement test. Many high schools include this on your transcript, so when you contact your high school to have that sent, you can check with them to see if your ACT or SAT scores will be on there as well. And the placement test can also be waived if you have English or math coursework on a previous college transcript. So if you are transferring into Lakeland and you've taken either in math or English, we can possibly waive that test for you as well. If you are required to take the placement test, you would sign up for it through the My Lakeland portal, and you would go to schedule it, which the icon is showing there on the PowerPoint. And then lastly is the new student orientation. This is required for all new and transfer students unless you have already earned a bachelor's degree or higher. Once you're admitted to Lakeland, you will automatically be added to the online orientation course through the Blackboard system. Information will be provided via email from our orientation coordinators. The online course will provide new students with information and resources available at Lakeland, as well as tips for being successful. Once you've completed the online course, the Student Service Center will call you to schedule a virtual or in-person appointment with the Counseling and Advising Center. We'll also be able to answer any questions you may have about financial aid or any other questions you might have. During your appointment with the Counseling and Advising Center, you will discuss your educational goals, and the counselor will assist you with registering for classes. And then that's just a list of different contacts that may come in handy during the admissions enrollment process. So the admissions office, if you have questions about applications or transcripts, the orientation coordinators would be able to answer questions about the online orientation. Recruitment is a really good resource for general questions about the college and admissions process. The Student Service Center can answer questions about pretty much any part of the enrollment process, including admissions, financial aid, registration, and scheduling and advising appointments. And then the Test Center can answer questions regarding the placement test. And I will kick it over to the financial aid.
I'm actually going to intervene real quick.
Sorry.
So if you're here today and you're not a Lakeland student, one of the benefits of actually coming today, we have folks on here to help you apply. We have Patricia from recruitment here, and of course Christina is here as well. So if you're not yet a Lakeland student and you're really interested in one of the programs to really get things started, we encourage you to apply today. Next we'll hear from financial aid.
Good evening. My name is Shannon Ogden Boyd. I am the Assistant Director for Financial Aid. So we're going to talk about the fun part. How do you pay for college? It's usually one of the first questions we get is, now that I have chosen what I want to do, how am I going to pay for it? So that's where we come in. So the different types of financial aid that we have available, they range from free money, which are grants. Oh, sorry. Helps if I click. I got lost on my own stuff. So the first step in getting financial aid is to actually apply for it. So depending on when you're coming, that determines which FAFSA, which is the free application for federal student aid, that you're going to complete. If you're going to be here for this current spring term, you're going to do the 21-22 application. If you're going to be here for summer of 22, fall of 22, or spring of 23, that one will require the 22-23 FAFSA. So you would go to studentaid.gov to complete that application, and based on which FAFSA you're going to complete, you would need your 2019 and or your 2020 income, tax return or your income, depending on your filing status. So if you need help completing the FAFSA, which that's the other question that we get a lot of, we actually have an organization on campus called LEAF, which is Lake Geauga Educational Assistance Foundation. They offer walk-in sessions every Monday from 10 a.m. to 2, and every Wednesday from 5 to 8 p.m. In C 2047. It's a walk-in basis. It's just a big open computer lab, and they will help you with the FAFSA if you need help. If those hours don't work for you, we can help you in our office. You just have to make an appointment with us, and we'll help you through the process of completing that FAFSA. So there is help available if, especially if you're a first-time person doing the FAFSA. We get a lot of questions, and people get very nervous about doing it, so they want us to help them at first. And then also, as always, once you're an accepted student, we only communicate through Lakeland email. So once we get the FAFSA, we will email you to let you know we have it, and then any future steps that you have to do to complete the financial aid process. And at any point in the process, if you have questions, please let us know. That's what we're here for. We want to make sure that the process is as easy and seamless for you as possible. So the types of financial aid that we have available can vary. Grants and scholarships are free money, so that's the money that you really want to go for first. A Pell Grant is a federal grant, and that is based off the results of your FAFSA. So even if you complete a FAFSA, you may not be eligible for Pell. It just depends on what the FAFSA says you're eligible for. And those amounts will vary. It's not just if you get Pell, you get a certain amount. It's based on your FAFSA results. And also, Pell Grant funds are based on your enrollment. If you're a full-time versus a part-time student, you get different amounts. We also have a short-term certificate grant, which is from the state of Ohio. There are applications on the table. It's a $2,000 grant per certificate program that you may be enrolled in, and that just covers tuition and fees. So you would be responsible for books and supplies on your own if you were to apply for that short-term certificate grant from the state of Ohio. And that grant, on top of some other certificate programs, will cover STNA, Administrative Medical Office Assistant, the EKG program, EMT Basic, EMT Paramedic, and the phlebotomy programs. So it's quite a decent amount of the health programs that it covers. There's also a Choose Ohio First, which is another from the state of Ohio, but this is a scholarship. It's a little bit different program. Those next cohort of students that we would be potentially able to apply for the scholarship would start in the fall term of 2020. And that scholarship actually covers certain STEM certificates, not all of them, and the amount varies as well based on how much your program will cost. And you have to be new to Lakeland or new to that certificate program to be eligible. And we also offer scholarships here at Lakeland. We have over $500,000 of scholarships that we offer students every year. So I tell students all the time, it's like the lottery. If you don't apply, you can't win a scholarship. So it's like the lottery. If you don't play, you can't win. So it's very easy. We have one application for all of our scholarships that we offer. So it's very easy to do the application. We do have funding available for this current spring term, and then we'll open up another application for the 22-23 age year. So there is opportunities that way. We also have an outside scholarship list available on the financial aid website, where we have information of particular scholarships that we know that we have those programs here, and we list that on our website for our students as well. Then the other option of financial aid is student loans. Those are things we try to encourage students not to borrow if they don't have to, but we understand sometimes that is a necessity. And only certain certificate programs are eligible for federal aid. Not all of them are because they are such a short program. So for other information, just let us know. But do remember that there are some loan opportunities through our office that are interest-free as well, that don't go through the government. So sometimes those are more eligible for students to use because they don't want to borrow the government loans. And then one of the other things that a lot of people don't know that we offer is additional resources. We have an immediate needs program. So if a student is facing an emergency that is causing them to potentially not be able to be successful or complete the program or the semester, they can submit an application with documentation, and we could possibly assist with that emergency. So it could be something like a utility disconnection, something like that. And then the amounts vary depending on what funding we have and what you need for your emergency. We also have a program called the Lakeland's Care Cupboard. It's been in operation since 2018, and it's a food pantry for our students. So it's free food and personal care items, and we do partner with the Cleveland Food Bank to provide a lot of that, the services for our students, and it's right by our Student Service Center. And students can use that at any time. No referrals necessary. They just have to log in, and then they could take whatever they need. We do have refrigerator, freezer, and then also just basic, canned good items and things like that. And then we also have ARP, or American Rescue Plan Emergency Grant. This is funding from the government. If you remember, last year the American Rescue Plan was passed. That's what created the stimulus checks that we got last year. So this is COVID funding that the government has given colleges for their students to succeed, and we will have funding for the remainder of the spring term, and we possibly may have funding through the summer. We don't know yet, but this is separate from any federal aid. So as long as a student is enrolled in at least one class and they're not a high school student taking college courses, they can apply for the art funding. And so some people, they don't use any other federal aid, they just use the art money, and that's how they pay for their classes. So that's another resource that we offer our students to make sure that you're able to pay for your courses and be successful and have everything that you need.
Thank you, Shannon. So as you just heard, there are several opportunities here at Lakeland to help you attend and pay for college and all the necessary things you need to get through and complete. And again, Shannon will be here, and we have applications for the grants over there, so make sure you check those out. Next, we're going to hear from Rick Amster from our counseling department.
Good evening, everyone. My name's Rick. I'm going to quickly go over some of the different services we provide at the Counseling and Advising Office. We heard from Christina about how to become a Lakeland student. We heard from Shannon on how to pay for college if you decide to be a Lakeland student. And then that's where I come in. The counselors here at Lakeland, do admissions counseling. The whole idea of admissions counseling is to make sure that you're taking the classes you need for your certificate, for your major. We also do ongoing academic counseling and advising. So you get your first semester under your belt. You want to make sure that you're still on track. Maybe you want to look into different programs. We do offer additional academic counseling and advising. We see you through the whole entire journey. Some of you may decide to come to Lakeland, but you don't know what you want to do. The counselors here also offer career counseling, where we look at different aspects of who you are as a person, your interests, your skills, your values, your personality. And we're able to take those aspects of who you are and tie them together to some options, opportunities that you may not know were available. And lastly, we offer personal counseling. So no doubt that making the decision to be a college student can bring on additional stress. All the counselors at Lakeland provide personal counseling. We're all licensed counselors, and we also have a full-time psychologist who provides counseling as well. So it could be something related to stress, anxiety, depression, or something simply like time management skills, being a new student, trying to maybe manage work, family, school obligations. We could also help with those items as well. All right.
All right, thanks, Rick. So our counseling department will be there for you basically through your whole process here at Lakeland. They'll be the ones to help you get started and pick out the classes, also to make sure that, again, that you complete all the classes you need so you could graduate. All right, so we're going to transition into no, we're not going to transition. We're going to meet our program directors right now and learn about the different programs that we offer here at Lakeland. And we're going to have Chris Jerzen start us off. Yeah, you could. It's clearer here.
Hello, I'm Chris Jerson, and I'm in charge of the medical coding certificate. So a medical coder goes through the patient's medical records and pulls out any diagnoses, what was wrong with the patient, any procedures that was completed, and then they apply code numbers which are sent to the insurance companies. And the insurance companies pay the hospitals based on those code numbers. So the hospitals always need good coders to make sure that money's coming in. So our medical coding certificate is 24 to 25 credits. It takes 3 to 4 semesters to complete, and it will prepare you to be an entry-level coder at a hospital, physician office, ambulatory surgery center. It will also prepare you to take 2 different certification exams. There's the CPC exam from the American Academy of Professional Coders, or the CCA exam from the American Health Information Management Association. It's also a ladder to our HIMT degree, our Health Information Management degree. And if you are someone that wants to go into medicine but doesn't want the blood or patient care, then coding is a great opportunity for you. A lot of our coders are working from home now. Even before the pandemic, they were working from home, but especially since COVID, they've been staying home. So, thank you.
Next, we'll be hearing from our dental assisting program director.
Good evening. I'm Margaret Burton. I'm the dental assisting coordinator here at Lakeland. The dental assisting program is 4 semesters. You learn about every aspect of the dental practice, and right now the doctors are screaming for dental assistants, and they're also screaming for hygienists too, by the way. And just a little plug for hygiene. You learn dental science, you learn the different dental materials, you learn your chairside skills, you'll learn your dental instruments, your radiography, you'll get your radiography certification, you'll have your CPR, and you will also take your certification exam for either the Ohio exam or the AMT, which is American Medical Technology, under the dental assisting program. And with those certifications, believe it or not, but your paycheck will go up as well. And we all like that idea, don't we? You will also learn practice management, and speaking about coding, you will also learn how to do dental coding during practice management so that the money's coming into the dental office to pay the office monies and also to pay your paycheck. So dental assisting really is a very hot field, and it will probably be a hot field for quite a while. Thank you.
All right, next we'll have Dan from EMT. And paramedic, sorry.
I am Dan Solomon. I am the interim program director for our EMT paramedic program. We offer EMT and paramedic program day and evening. We have them going simultaneously at the same time. We will have a summer EMT program coming up this year as well, which will be great. It'll be 3 days a week. We have the EMT paramedic are both right now a huge in-demand field as well as everything in medical. We have lots of our chiefs and officers back there that we do our clinical experiences with today that are looking to meet everyone as well. And we have a great lab upstairs that we would are more than happy to walk around with you and show you our facilities here.
And that's the ambulance that they have in their lab. It's pretty cool. All right, so here I am. I am Denise Lash. I am the program director of Administrative Medical Office Program, Medical Assisting, and the EKG certificate programs. So medical assistants are known as the multi-skilled healthcare professional just because they perform both administrative and clinical duties. Most medical assistants typically work 9 to 5. Minimal weekends, and yes, we do get some holidays off as well. You can find medical assistants in urgent cares, physician offices, and other ambulatory care centers or outpatient facilities. Our program here at Lakeland for medical assisting is a 12-month program, is a multi-certificate earning program, meaning if you do medical assisting, you actually earn 3 certificates in the program for administrative medical office, medical assisting, and EKG. So if you're looking to later pursue the multi-skilled associate's degree, there's your certificates you need that transfer easily into there. The job outlook for medical assisting is excellent. Medical assistants are in high demand, and they're really working everywhere now. We are doing great things, not just the medical assisting program here, but all the certificate programs here at Lakeland. We are involved in the community. These are some pictures from our Medical Assisting Awareness Week. You may see some of these faces floating around here. We had a great time just telling everybody what medical assistants do. We did a community event where we had Kirtland Fire come out. We learned how to use fire extinguishers, and then we just got some awesome equipment through a grant that Ohio granted us for our medical assistant and STNA program. All nursing always gets all the good stuff, the nice mannequins that move and burp and give birth and all that stuff. Well, we got it too. So we're doing cool things, and we got new things, and I'm super excited about it as well. So. Next, we'll hear from Liz about our phlebotomy program here at Lakeland.
Hi. So the phlebotomy program, if you don't know what phlebotomy is the art of taking blood. Our program is 2 semesters long. The need for phlebotomists now is higher than it ever has been. You can finish my program or our program, and the minute you do your last day of clinicals, have a job. That pays you benefits, that pays you a decent wage. Between the part-time teacher and myself, we have 61 years of phlebotomy experience. The last 3 classes I have had, each and every one of my students ended up with a job. So I think that speaks very well of what we teach. Our students are in high demand from most of our hospitals that we assist with and our medical centers, family health centers. So it's only 2 semesters long, and we would really like to see a lot of your faces in our program.
Thanks, Liz. Next, we will have Erin come speak about our polysomnography program.
Good.
Yes. It's that midterm background.
That's a mouthful. Hello, everyone. I'm Erin Toth. I'm the program director for polysomnography, and yes, it's a mouthful. This program, my program, is a part-time, I would call it. It's Tuesday evenings, and it is the art of learning how to watch people sleep. And you are performing sleep studies overnight. So this certificate program will prepare you for a career of working 3rd shift for the majority, at least for your first few years. So that's interesting to you. You don't always stay on 3rd shift. Eventually you can become a daytime sleep study scorer where you're looking over the sleep studies and possibly managing the lab. The program is 3 semesters, and it starts every fall and only in the fall, so you want to get in while getting is good. And it's Tuesday evenings, and there's a lecture, lab, and a clinical component. So in your 2nd and 3rd semesters, you'll go out and work in the sleep lab overnight, 1 night a week. And in the summer, which is your 3rd and last semester, you'll go out 2 days. The program allows you to earn 2 certificates. You have the EKG and the polysom after completing the year. It's 32 credit hours. The clinical rotations are housed at Metro Health, UH, and Cleveland Clinic. And just like all of my colleagues here, sleep techs are in high demand. There's about 30 openings right now between Cleveland Clinic, UH, Metro, private labs, and I have 7 students currently, and 90% of them are already employed. And we're already in our 2nd semester, and they're already working as trainees. So the pay is very good. And once you get through your 1st semester, you'll be asking everyone you know if they snore. And you'll be able to tell them why they snore and what to do about it. So I hope to see you soon. Thanks.
All right, and lastly, we have Shaquita, and she's going to talk about our STNA program that we offer here at Lakeland.
Hi, everyone. I am Shaquita. I'm the director for the STNA program, which stands for State Tested Nursing Assistant. This program is only 8 weeks long. 6 of the weeks are lecture and lab, and 2 of the weeks are clinicals. The classes, the lecture and lab are Tuesdays and Thursdays, and the clinicals, the last 2 weeks are just 1 day a week. I broke it down to 1 day a week because of COVID, and you will get a full day of clinicals and plenty of experience to take to work. Doing a program that's 8 weeks long allows you to get in and get out of the program and have a job very quickly. Nursing assistants are in very high demand right now, and you can get a job in a hospital, a nursing home, or you can work and do home care. The pay is very well right now, especially due to COVID, so this is really a good time to get in and lock your pay rate in with a lot of these facilities. You literally could walk out of my program with a job with no problem. Once you finish the program, you'll have a certificate. So sometimes people get a little confused and they think they're state tested right away. You get a certificate and then you take your state test immediately after the program. You can take it in the lab that we have up there, which makes it a lot easier for you to be comfortable and a better chance of passing the exam. And if you don't want to do that, you can take it on your own later on. But either way, you can work with or without the state test. You get paid a lot more if you are state tested, so it is a good recommendation for you to be state tested. We will be up in the lab. We'll be showing our lovely mannequin later on after we're done here, and you'll be able to see all the things that we get to do as nursing assistants. Thank you.
So you probably noticed a couple of things while meeting the program directors and while they were talking about their different programs. All these professions are in high demand, right? And all these programs give you an opportunity to sit for national examinations, which will give you those fancy letters or credentials after your name, right? Also, all these programs, most of these programs have scholarships behind them. So it makes it possible for you to complete the program with funding. Right now, we are going to open the floor up and have a panel type discussion to answer any questions that you may have. All right, Ani, ask the question. Come on. Iani's one of my students.
Hello. I'm a little nervous, so bear with me. All right, so my name's Ayani, and I am in the medical assistant program. Denise last year here, she's my teacher. When I first started this program last year, during August, well, it was during the summer, like online classes, but during the August, we came in here for in-person. I came in here not knowing anything we were gonna do, and I just wanted to get my foot into the door of the medical field. I knew that I wanted to help people. I knew that I loved like the human body, and I wanted to be more interested in it. So I knew I had to go to school to learn something about the healthcare, and I knew that I wanted to work with people. So I looked into being an MA, and all I can say is that I am so happy that I did this, because not only did I earn hard skills like learning how to do blood pressures, and a lot more stuff with billing and all that, but I also learned soft skills. I learned how to talk to people. I was very nervous before I started this, as you can see. And I made new friends. I'm happy for my teacher. I see them as role models. And I feel like if you guys are very interested in this, you guys should take your chance and do it, because it might just change your life like it did to me. And I'm very grateful for having you as my teacher.
Thank you.
You too, Miss Angie, and our classmates. I'm just so happy. I'm very emotional. And if you guys have any questions, let me know. I'm happy to answer a lot. If you guys are very interested in the MA program, if you guys have any questions, let me know.
Awesome. And that goes for all of our programs here. That's a benefit. Yeah, thank you, Ayani. Sorry. That's a benefit of going for a certificate. I mean, I could kind of relate. I once sat where you sat and really not knowing where I was going, or, well, not saying that you all don't know that. But anyways, maybe some of you don't know where you're going, but you know you want to get in healthcare. Earning a certificate is your way in, right? So you're actually earning college credits, and these certificates stack. So if later on you're like, hey, I want an associate's degree, you could come back and get an associate's degree. And then guess what? If you want to go later on and earn a bachelor's degree, you go earn a bachelor's degree, and then later on, master's, and do whatever you want. That's my story. That's how I got it. So you're making a good decision being here this evening. I appreciate you coming.